Hi, my name is Nathan Stowe. I'm with Stowe Training Systems. I'm here today with Dr. Ken White of Chiro Lifestyles, and we just want to take a minute and talk to you about a couple of the top reasons that your back may be hurting you. The first thing we're going to do before we can get anything else, though, is go through a quick pain assessment. What this is going to do is let us know if there's any sort of structural issues. So that's pain assessment's real simple. What you're going to do is get on the floor here. You're going to rock back here to test flexion, and you're going to go here to test extension. If you feel any sort of like additional shooting pain when you're doing that those movements, then you most likely have some sort of structural issue. And at that point, your best course of action is going to be just go see Dr. White. So Dr. White, if somebody's feeling pain during that, could you tell us a little bit about what might be going on there?
Okay, what you basically have is a structural problem that's creating a pressure on the nerve roots, which is creating more pain in the area, and also you're getting contraction of the muscle, and this does not go away even with the exercise. Now, when you come in, what we have to do is to assess the situation. So we're going to examine x-ray, put together the diagnosis, and then give you a game plan to fix it.
Sounds good, Dr. White. Awesome. So cool. So you go see Dr. White, you failed that, I hate to use the word fail, but you're hurting on that pain assessment. So I guess you technically passed it. Dr. White puts you back together. Everything's lined up. We've got those bones off of those nerves, but now you still might be feeling a little bit of pain. So now what the issue is going to be is either A, we still just need to continue strengthening those tendons, ligaments, and muscles around that area because it can pop back out of place and you just end up going back and forth and can't get that permanent solution. Or B, that pain is actually still just in your brain. And we know that's true because you can look at somebody like an amputee where they're missing their arm, but they can still feel it. So we know that it's a brain issue. Well, in the lower back example, what's going on is that the brain is firing on overdrive to your lumbar region because of that previous injury. So instead, what we can do is strengthen all the muscles around it, and one, get that physical thing. Yeah, those tendons, ligaments, and muscles are going to get stronger and denser. But two, when they're getting stronger, they're going to have what's called reciprocal inhibition, which is going to allow that lower back to relax. Now, the best way to define reciprocal inhibition is to think about the fact that, like, anytime one muscle in the body does one thing, the muscle on the other side of the body does the opposite. So, for instance, if you flex your bicep, your tricep lengthens. If you flex your tricep, your bicep lengthens. So, by doing these exercises for muscles around and opposing that lower back, it's going to automatically relax and it's not going to feel tight anymore. So there you have it, a couple of top reasons that your back might be hurting you, as well as some actionable items of what to do so that it won't hurt you. Again, I'm Nathan Stowe with Stowe Training Systems, and this is Dr. White with Chiro Lifestyles.